Let's expand on this now. Joining us is Dr. Phillips, the Department of Water and Sanitation Director General. A very good afternoon to you. Thank you for your time. Now, these latest reports reveal a shocking state, really, of South Africa's drinking water and the poor management of sewer systems. As you looked at some of the key areas of concern, I mean, the Minister mentioned some, what was the implication of these results?
Thank you very much, Impo. Good afternoon to you and good afternoon to your listeners. We issued our blue, green and no drop assessments of municipal drinking water and wastewater systems in December. And the assessments indicated, as you indicated, that there's been a decline in drinking water quality, and there's also been a decline in the performance of wastewater treatment systems. The implications is that if the quality of drinking water declines and when drinking water doesn't meet the required standards, if at that time a municipality doesn't warn its residents that the water is unsafe to drink and that it must be boiled before it's drunk, then it can pose health risks to the residents of the municipality. In addition, if wastewater isn't properly treated before it's put back into the environment, back into rivers, then it can also be both a hazard to the environment, a hazard to downstream users of the water in the river, and also a health hazard because it's internationally known, for example, that fatal diseases such as cholera are associated with sewage pollution of water resources.
So what you're essentially saying here is that what's been uncovered shows that South Africa might be headed to a never-experienced water crisis period as the quality of drinking water is becoming worse in the regions of the country. What's of huge concern is the fact that South Africa seemingly lacks the necessary capacity to deal with the crisis.
Well, it's more complicated than that, Impo. As a country as a whole, I don't believe that we lack the capacity to deal with the crisis. So when we did these assessments, we found that some municipalities are doing very well. And by the way, generally the metropolitan municipalities in the main cities in South Africa are doing relatively well, generally speaking. And the water, it was found that the water is safe to drink in the major urban areas, in the major cities. But the fact that some municipalities are managing to perform well, and it's not only in the cities, some small municipalities in rural areas also scored good and excellent scores, means that it should be possible for other municipalities to also do very well. And those municipalities which have done very well, we found had good billing and revenue collection systems. They had low levels of non-revenue water. The municipalities prioritized budgeting for the maintenance of their infrastructure, and they'd hired the right numbers of staff with the right qualifications. And the question arises, if those municipalities were able to hire the right staff with the right qualifications, is the reason why other municipalities are not having the right staff, the right qualifications, because the skills are not here in the country, or just because they haven't taken the necessary decisions and created the necessary posts and made sure that they hire those people with the right qualifications?
Another concern is that many of the municipalities' wastewater systems and water treatment works have also deteriorated. You make mention of some of the action plans that have been put in place, but what are some of the others when it comes to issues which need to be included in the action plans, which need to be developed by the water services authorities?
Well, yes, we agreed at the summit. We got a commitment at the summit that all the water services authorities would produce action plans. And we spent a lot of time going through the detailed assessment results for the different groups of municipalities and discussing with them the causes of good performance and bad performance. And we reached agreement with all the different groups of municipalities as to what are the key things that they need to do in order to improve. And the municipalities committed to develop action plans to address those key things and send them to us. But over and above that, we agreed that for the worst performing municipalities, they need to do more than just develop action plans to address issues which have been on the table for years. And we agreed with them that they would start a process of considering alternative ways of delivering the water service. For example, by requesting a water board to assist them to deliver the service, or going out to the private sector and entering into a concession with the private company to deliver the service, or entering into a special purpose vehicle with a water board to provide the service. So we are also looking at fundamental change, and there was an agreement, particularly amongst the poorer performing municipalities, with the support of the South African Local Government Association. They would start a process of discussing in the different municipalities, in their councils, and with the communities in those municipalities, the possible options for fundamental change and doing things differently in order to get more capable and professionally managed water service providers in place.
So in raising the profile of the quality of water and sanitation services, how much is being budgeted for this overhaul?
Well, water and sanitation in South Africa is not something that's funded from your income tax or from your VAT. Water and sanitation services are funded from revenue that municipalities get from the sale of water. I'm sure, Impo, where you live, you get water bills from your municipality and you have to pay them. That's the source of money to fund the maintenance and operation of water services in your municipality. So municipalities, it's imperative that municipalities have good billing and revenue collection systems. They make sure that they're not losing water for revenue purposes through leaks, that they collect the revenue, and then that they prioritize budgeting for water services from that revenue they get from the sale of water. In addition to that, the national government does make funds available through various grants to assist municipalities to address water and sanitation infrastructure backlogs. In total, municipalities get approximately 20 billion rand a year from the national government in grants to assist them with their infrastructure backlogs. But the short answer to your question is that municipalities must get the money required to provide water and sanitation services from the sale of water to their residents and to businesses and industries in their area, and therefore they need to particularly focus on reducing non-revenue water, on effective billing and revenue collection.
Very well. Thank you so much for your time. Let's perhaps leave it there for now. Dr. Sean Phillips.